Barb. I'm going to be your nurse practitioner student today. I'm going to be working on an assessment of your head, eyes, ears, nose, and throat. Part of it I'm going to have to be touching you, so I'll be touching your face. You okay with that?
Yeah.
Okay. So first thing I'm going to do is I'm going to be assessing your head and your skull. I'm looking to see how symmetrical your head is. I'm feeling your skull for any lesion or for any bumps, lumps. Checking to see where your everything feels good. I'm going to take a look at your scalp. I'm looking to see if you have any scaliness, any dandruff, if there's any lesions in here. Scalp looks great. Okay, all right, that's great. Facial symmetry looks good. Can you smile for me? Right, I don't see any irregularities with your face. So I'm going to be moving on to your eye exam. So the first thing that I'm going to be doing is touching your face. I'm going to be taking a look at your eyes. Go ahead and look up. Checking your sclera. Looking to see if you have any swelling in your conjunctiva. Everything looks nice and pink. I don't see any lesions. Do you have any problems with your vision?
No.
Nope. Okay, so I'm going to be taking a look closer into your eyes. First, I just want you to go ahead and follow my finger. All right, so she is able to follow completely. I'm going to follow my finger now. She has great eye movement. I'm going to be using a light to shine into your eye, checking out how your pupils react to light. So go ahead and just look straight ahead. So her pupils react to light equally. All right, next I'm going to be coming in a little bit closer to your face because I'm going to be looking at the back of your eye. So go ahead and just look straight on over my shoulder. Look straight ahead and don't look into the light. Okay, it's great. So I see the red reflex. So now I'm going to be coming a little closer in. Check my diopter. Great. I'm going to take a look at the left eye. Okay, great. So I was able to visualize the optic disc as well as the vasculature, the arteries and the veins. And I didn't note any lesions or anything in the back of the eyes bilaterally. They're great. I'm going to have you do a vision test. You don't wear any corrective lenses?
No.
Okay. So go ahead and put this over your left eye and then just read the smallest line that you can.
ORZSK.
Great. Cover your other eye.
Do I do the
Same thing.
ORZSK?
Great. So go ahead and now read the lowest line with both eyes.
ORZSK.
Great. So you have 20/20 vision. Perfect. Thank you. All right. So next, I'm going to be looking at your ears. So do you have any problems with hearing?
Mm-mm.
No. Any hearing loss?
No.
No. Okay. So your ear, the skin on your ear, the auricular, and your tragus, they all look great. I don't see any lesions. I'm going to take a look in your eye, in your ear. Okay, I'm looking in. I don't see any extra hair. I'm able to visualize your tympanic membrane. It's nice and pink in there, but it's not red. I don't see any perforations or lesions. Looks great. I'm going to take a look at your other side. same. Quality of your skin looks great. There are some piercings, but I don't see any infection. All right, so now I am gonna go ahead and take a look in. Let's see. Tympanic membrane, malleus, no perforations, no redness, no lesions. Looks great. So next I'm going to be doing a hearing test. So when I come behind you, I'm going to whisper something. You're going to cover the opposite ear and you're going to tell me what I say. Okay, so go ahead and cover your right ear.
Facebook.
Great. All right, so now I'm going to come around to this side.
Instagram.
Good. I did forget to test your peripheral vision. So I'm going to go ahead and put fingers next to you and you just let me know when you can see them.
Okay.
Okay. So in a normal exam, because you passed the whisper test and you have no issues, I wouldn't go any farther, but for the demonstration purposes, we're going to go ahead and do the tuning fork test. So I'm going to put this on top of your head. Just let me know if you can hear better in your left or right or the same.
Same.
Great. All right, so now I'm going to be putting it behind your ear and let me know when you stop hearing it, and then I'm going to move it next to your ear and then let me know when you stop hearing it.
Okay. Okay.
Great.
Okay. Okay.
Great. So it's about the same on both sides and just about twice as long with it next to your ear as behind your ear, so that's completely normal, so that's great. All right, let's see, where were we? Oh, ears. Okay, so we finished the ear portion and now I'm gonna be looking in your nose. So do you have any problems with smelling or anything? No? All right, so go ahead and cover your one nostril and breathe in and out. And then you can do the other. Do you have any problems with that? No? Okay. I'm going to take a look inside your nose. So let me get kind of close again. All right, so I can visualize her turbinates. I see your septum. No exudate, no lesions. Looks nice and pink. All right, to go to the other side. Oh, there they are. I see your turbinates. Nice and pink, no lesions. Your septum, no deviations. All right, go ahead and pause it. Carrying on, I'm gonna go ahead and be feeling your sinuses, so your frontal sinuses. Let me know if any of this hurts. Any pain or discomfort?
No.
No, great. Okay, so moving on to your mouth. See, your lips look nice and pink. I don't see any scaling, any chapping. I'm gonna take a look in your mouth. So go ahead. It's fine. Okay. So go ahead and say ah.
Ah.
Ah. Okay, so she was able to lift her soft palate, which is her vagal nerve, nerve 10, cranial nerve 10, so that's great. So go ahead and go back in there again. Ah. All right, I can see her uvula. I'm going to go ahead and just push your tongue down there. No tonsils. Let's see, her mucosal membranes all look nice and pink. Go ahead and stick your tongue up.
Oh.
Great. nice and pink, good dentition. All right, looks great. Do you have any issues in your mouth? Nope. Taste, your tongue looked like it was in good condition. Go ahead and stick your tongue out for me. And left to right. Great. So that was her hypoglossal nerve 12. So she's intact. All right. Okay, so now I'm going to be checking out your neck. I'm going to be feeling for your lymph nodes and also for your thyroid. So first, I'm just going to be noticing that her neck looks symmetrical. I don't see any goiter. I don't see any lesions. Her skin looks like it's in good condition. So I'm going to start with her preauricular and her posterior auricular, occipital. Just feeling for any lymph nodes that are hard or nodules. So far they feel really good. So I'm going to be going into the tonsillar, submandibular, submental, superficial, cervical, posterior cervical. Go ahead and look down. Supraclavicular, and then the deep claviculars. All right, all looks good. So now I'm going to be taking a look at your thyroid. So first I'm looking for your thyroid cartilage. Okay, and here I found your cricoid, and then it should be right below. So I think that we're going to find your thyroid right in this area. All right, so go ahead and get a sip of water. Okay, now go ahead and hold some water in your mouth. And when I ask you, just try to swallow just a little bit at a time so you have some left over. Okay, go ahead. All right, so I found her thyroid. It looks, just swallow a little bit again. All right, so it looks actually like maybe just a little bit bigger on her right side than her left, but it feels soft, mushy. I don't feel any irregularities. I'm gonna feel for her carotid. Oh, there it is. There's that one. So I'm gonna go ahead and take a listen. Listen for any bruise. So I'll go ahead and breathe normally, and I'll tell you when to hold your breath. Okay, hold your breath. Great. No bruise. Sounds great. I don't see any jugular distension. Everything looks great. Thank you.